to join our voices and our hearts in prayers for justice and wellness accessible for all people. Our faith practices bring us together in common teachings grounded in the sacred blessingness of all of humanity. And we are one in understanding the way to the Holy Divine is through love for one another. Our stories tell us that humanity made in the image of God, and we come together to honor the image of God residing in so many in our country who are without access to proper health care. Tonight we remember the millions of Americans who do not have funds for medical services. We remember the 13.3 million children, the 1 in 6 children in America who live in poverty. We remember the 9 million children, 1 out of 9 who have no health coverage. We remember the 800,000 pregnant women who are uninsured each year, and the infants who are born to those uninsured mothers who are 3 times more likely to die before their first birthday than those whose mothers were insured. Imagine God in the faces of these. On an average week, nearly 220 Nebraskans lose their health coverage, which means that 31 people every day must struggle with the health of the people they love and their financial responsibility.
My family lost our health insurance when I could no longer tolerate working 3 and sometimes 4 jobs. I can only barely afford health insurance for myself alone on the plan offered by my full-time job. Trey Warner.
My best friend got cancer twice in our 20s and needed a bone marrow transplant. His insurance company, though, wouldn't cover it. He was bankrupt by his early 30s. Patrick Jones.
Happy ending. My 15-month-old baby seemed dehydrated from what we thought was the flu, and we took her to the ER at Children's Hospital. It turns out she was going into septic shock and had to be rushed to the PICU, where she stayed for 5 weeks, to be put on life-saving medications and machines. Doctors told us that in another hour, she would have gone into cardiac arrest. Thank God we have insurance. And we didn't hesitate that hour while we worried about bills. We didn't hesitate to get her the care she needed. If we had stopped just 1 hour, our chatty and healthy and spunky 3-year-old would not be with us today. Sherry Schuler.
I diagnosed a man with diabetes a few years ago. He was well managed on diet, exercise, and insulin, but then I didn't see him for 3 months. When he came back to clinic, he said he'd lost his health insurance, so he'd stopped coming to clinic and he'd stopped his insulin. Susan Kiesling.
I pay $1,000 for 1 year of health insurance because I'm a student, but I have to bring something to get me care.
Sarah Hanley.
For those of you who have masks that you have written your stories on before we began this time together, during this next time of song and prayer and reflection, we invite you to bring your masks forward and to place them on this wall that we might share them together. And if you haven't had the opportunity to write your story on a mask, we invite you to do that at the close of this service, at the close of our time together, that we might share these stories with our representatives in Washington, D.C.
Tengo un amigo que le diagnosticaron pulmonía, le cobraron $3,000 en el hospital, no tiene trabajo y no tiene aseguranza. Henry Powell.
I have a friend who is having problems with his lungs, and he wanted to go to the doctor, and so he did, but he did not have a job or insurance, and they charged him $3,000 and he cannot pay it.
My name is Lynn Anderson. I'm a long-time advanced practice nurse. One story that quickly comes to mind is a couple who came to us. The woman had just been diagnosed with cancer, came to us at University of Nebraska Medical Center. She was about 58, 59 years old. Came from outstate Nebraska, good farm people, had some land, not much money. We went through with her what it would entail for her to be treated, and she then asked what the cost might be. We gave her an honest answer. It was a lot of money. She then looked at her husband and said, "I'm not going to have treatment. It would bankrupt my husband. He would be destitute in his old age." I wanted to say, "You're wrong," but she was right. The only thing we could offer is if she wanted to divorce him, then she could get Medicaid. She said, "We can't do that. That's not our way. This is not the country that we think it is if we don't provide care for people like that."
But if 2 and 50 make a million, we'll see that day come around. We'll see that day